The role of genetics in mental health. According to the DSM and ICD, there are hundreds of distinct forms of mental or psychiatric illnesses. Many diseases fall under distinct categories, which include but are not limited to anxiety disorders, mood disorders, psychotic disorders, intellectual disabilities, developmental disorders, personality disorders, eating disorders, sleep disorders, dissociative disorders, sexuality-related disorders, substance use disorders. Hi, and welcome to Mind Stretcher. On this channel, I cover a wide range of topics related to psychology and mental health, from the importance of self-care to the benefits of mindfulness and meditation. I offer practical tips and advice for improving your mental health in your everyday life. Join me as we learn more about the genetics of mental health and the roles that they play in people's lives. Let's get right into it. There is no one psychiatric or mental condition that has a complete genetic foundation or heredity, and numerous environmental circumstances may substantially impact the risk of getting a specific disorder or not, regardless of the presence or lack of genetic elements. As a result, many of these ailments have multiple origins, some inherited and others environmental. Only illness is having a significant genetic foundation will be mentioned in this article. A vast number of mental problems are heritable, which means that having a condition rises dramatically if another family member has it. In addition, without a family history, unique genetic changes or polymorphisms may predispose individuals to a high risk of mental disease. Genetic mutations, polymorphisms, or epigenetic modifications described further below can influence brain development in ways that modify the conventional wiring of the brain. As a result, mental problems can develop at any age, for example, from birth as an ASD or later in life in conjunction with environmental triggers as in bipolar disorder. When compared to neurotypical individuals, these predispositions may lower the threshold necessary for mental problems to emerge in adults. Bipolar disorder, bipolar disease, which affects up to 4% of the population, is one of the most strongly genetically inherited mental disorders. Intervals of depression are followed by periods of unusually heightened mood mania, hypomania, and bipolar disorder. While environmental influences are recognized to be key causes of bipolar illness, it is believed that genetic factors account for 70 to 90 of all instances. Schizophrenia. Schizophrenia is considered to have a genetic inheritance of 70 to 80. Having a first-degree relative with the condition, like having bipolar disorder, greatly raises the likelihood of acquiring schizophrenia later in life. However, environmental variables are also quite essential. However, distinguishing between genetic origins and common environmental circumstances is challenging. Multiple inherited or novel mutations polymorphisms, when combined with environmental triggers, can enhance the likelihood of developing schizophrenia. If you are enjoying the video so far, make sure you hit the like button and turn on post notifications for more content. Don't forget to subscribe as well. Autistic spectrum disorder ASD. ASD is a neurodevelopmental disease that generally manifests itself from birth. 2 megapascals, Shank 1-3, Cacne B2, NRXN, SYNGAP, UBIA, KC and Q2 3/5, 2 shillings, and 1 cent 3, to mention a few typical examples, have been linked to ASD. Many of these genes are linked to particular ion channels and synapses, suggesting that synaptic and brain network development is aberrant. As a result of such a broad array of genetic abnormalities in ASD, it is predictable that there is a high degree of clinical and genetic variability in ASD depending on which genes are affected and what mutations occur. Summary: in general, mental psychiatric diseases such as bipolar disorder, schizophrenia, and autism spectrum disorder ASD have substantial genetic roots mutations, polymorphisms, and epigenetic modifications that can be inherited directly from an afflicted parent or developed novo during development. While certain important genes are implicated in distinct illnesses, there are several pli-RPIC genes that are implicated in all of these disorders that are based on deficiencies in single genes, for example, DCC, and calcium channel genes, for example, CACNIC. As a result, many of these disorders arise as a result of abnormal neurodevelopment, which can either cause disorder from birth ASD or strongly predisposes individuals to develop psychiatric conditions later in life, particularly when combined with additional environmental factors such as stress. Thanks for watching. Comment down below on what we cover next. We hope you found this video helpful in understanding more about psychology and mental health. Remember, it's always important to take care of your mental health and seek support if you need it. If you enjoyed this video, don't forget to like, comment, and subscribe to our channel for more content on psychology and mental health. Take care and have a great day.